Thank you. For me, the best part of being a nurse is also the hardest. Caring for people when they are their most vulnerable, holding their hand through their most difficult moments. It's a privilege, but it can also be exhausting. I know, I've been a pediatric critical care nurse for over 20 years. And each year, I eagerly anticipate the annual American Association of Critical Care Nurses, AACN conference, so that I can connect with others who understand what it means to be a nurse in the way only a nurse can. During the height of the pandemic, when we needed it most, this time together was lost, and all in-person meetings and conferences were canceled. Of all the effects the pandemic has had on our lives, no other aspect has been impacted as significantly as our ability to meaningfully connect with others. Healthcare workers are planning to leave their organizations at escalating and alarming rates. 67% of nurses report they plan to leave their jobs within the next few years. With the average cost of turnover for a bedside nurse at $40,000, nurse attrition can cost a hospital close to $7 million each year. This past May, when AACN held its first in-person nursing conference in 2 years, I eagerly masked up and I boarded that plane to Houston. I wasn't sure what to expect. How could we possibly unpack all that we experienced over the past 2 years so that we could begin to heal and to find our joy in work again? AACN partnered with Dear World and transformed the conference into a safe environment of belonging. How they did this was simple but powerful. Conference attendees were led through a storytelling experience in which we selected one word or phrase and sat for a professional portrait featuring this message written on our skin. As we waited in line for our photos to be taken, we wrote the messages on each other, and a magical thing happened. We laughed and we cried. We connected through our stories. Dear World created a psychological safe space to encourage deep connection, vulnerability, and expression. People shared pieces of themselves they'd never shared before. When I returned home, I couldn't stop thinking about this experience. And I asked the question, how might we partner with Dear World to scale this solution and reimagine our healthcare culture?
We call this program Dear Hospital. Dear World's simple 3-step process unlocks powerful connections between individual stories and the organization. This can be scaled up or down and accommodate both live and virtual settings. Nursing is grounded in relational understanding, unity, and connection. This solution leverages tools familiar to healthcare workers to connect to others in empathetic and meaningful ways. Here's what a 12-month implementation plan looks like. We kicked off earlier this week with a pilot storytelling facilitation for the senior hospital leaders. Next, a select group of hospital associates will undergo a storyteller training program and learn to lead facilitations inside the organization. We then begin to roll out the Dear Hospital experience with mid-level leaders and finally launch across the organization as a whole. What we've learned from pilots across other industries is that 84% of participants report a stronger sense of belonging to their organization, and 86% feel more connected to the organization's core values. Our goal with this project is to improve joy at work by 20% within 12 months, as measured by the Mini-Z survey. Additional outcome measures include increased sense of belonging and improved associate engagement scores. This will result in decreased turnover and a significant reduction in workforce cost. For every 20 travel RNs eliminated, the average hospital can save $3 million. Ultimately, we know that improving associate well-being increases patient and family satisfaction and leads to better outcomes. Dear World is a unique partner for this project. They offer the only Train the Trainer program and storyteller certification on the market. What makes Dear World novel is the focus on individual stories. We believe that an organization is made up of the sum of its people and the stories within. The work is completely customized so that participant stories align with organizational values and mission. Healthcare organizations are struggling to retain employees, and employees are struggling to find meaningful connections to the organization and fulfillment in the work. Shared storytelling experiences create connection among employees and the organization, as well as refueling passions to the mission and the work to be done. Deer Hospital provides this opportunity. The healthcare industry is one of the largest sectors in the United States. This solution can be scaled to include over 7 million healthcare workers in 6,000 plus hospitals in the United States alone. Deer Hospital connects clinical, non-clinical, ambulatory, and even remote healthcare workers to each other and to the organization through storytelling.
We are requesting $100,000 to support a one-year Deer Hospital program launch. This will fund the vendor partner expenses to train 10 Deer Hospital storytellers within our organization and the licensing fee for our 5,000 associates and providers. As you've heard, our team has already taken steps to secure buy-in from our executive leaders this week.
1 minute.
And in-kind funding. The upfront investment in year one will allow us to pilot the program, and it'll more than pay for itself if we can prevent the turnover of just 1 or 2 associates per year. Moving forward, we will integrate this experience into our new hire orientation so it becomes woven into our cultural fabric, setting the tone from day one that we all belong at the table. This grant allows us to implement a simple solution that's proven in other industries into our workplace. We have assembled an amazing team. We know that storytelling can play a powerful role in how we scale and grow our organizations and our people are our most treasured assets. Our stories matter. They connect us to each other, our shared values. Deer Hospital will help us to emerge from the great resignation and empower a great reconnection. Thank you.